Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. Let's jump into it. Welcome to Voices of Otolaryngology. I'm super excited today. I've made a new friend, Dr. Tali Lando. Did I pronounce that right?
Perfect.
All right. Well, tell us about yourself. Can we do everything in 70 seconds? Med school, residency, fellowship, where you are now. Try to do that all, Dr. Lando.
Okay, so I did my residency at NYP, which was Cornell and Columbia in the city. And then I did my pediatric airway fellowship at CHOP in Philly. I actually took my first job out of fellowship at Westchester Medical Center, where I have stayed for 15 years. And I have a really busy clinical practice. We've always had a residency teaching component, but now we have our own residency. So kind of shifted from semi-academic to more academic. And I have 3 kids. I live in Westchester, 2 dogs, a husband as well. And that's me in a nutshell.
Amazing, amazing. Your nutshell would be quite large because we could talk hours about you as a person, and I'll tell everybody how I know that. Just in a joking sense, you know the world is bigger than New York and Pennsylvania, right? I mean, it seems like that's been the epicenter for you.
No, actually, yes. And embarrassingly, I also went to undergrad at Columbia, so I really never left. Yeah, my family is very New York centric, I will say.
No problem. It's a compliment. It's a good thing. Tell us about your practice a little bit. You said you're in an academic setting. Give us kind of like what a week looks like for you, or what kind of patients you see, and then I want to get into something entirely different. So be ready. We're just gonna pivot from there.
Okay, so typically I have 3 clinic days and 2 full OR days. I do see a lot of bread and butter just because of my patient population, probably 80-20, sometimes 70-30, where 80% is really tubes, tonsils, thyroglossoductus, nasal congestion. But then I have this really diverse 20% because we are a major medical center with a huge catchment area. So very complex zebras, which can be, mainly NICU, PICU, transfers. We don't have a huge airway reconstruction program, although we do see kind of everything but. And it is like a level 1 trauma center that I'm based in with a freestanding children's hospital.
Awesome. Now let's completely pivot. I was blessed to interview you for fellowship. We're both pediatric otolaryngologists, and I think we didn't end up together because we're not New York in Washington, D.C., but I was blown away to know you're an author, and you're not a first-time author, you're a second-time author. We got connected through some mutual friends, and I read your book, Breathless. It was amazing. I couldn't put it down. I've told everybody I know about it. What is Breathless? What is the book? And then I want to get into your mind. Why did you write, et cetera, et cetera. But anyways, what is Breathless?
So Breathless is a 16 case medical memoir, if you want to kind of, reduce it to that. But basically each case I structured like the OR because I wanted to be able to choose cases that have a really huge arc, something that was very unique about the journey of this patient and that had a lot of takeaway messages that could be applicable to people in training and also people already out in the field. And then I, in each case, get very deep into the aftermath of how these patients affect us. And obviously, I use them as examples because they could apply. You learn all this spillover element could be in any patient situation. And talk about what happens after you leave the OR and after you leave your clinic, and how does this reverberate into your personal life. And I'm brutally honest, so I think that maybe is what makes me a bit unique, is that I'm not ashamed and I never regret sharing those personal experiences, even if it's revealing and along with a lot of mistakes. And so this kind of compendium of my 15-year career with all the wisdom I've gained from others and from myself and from failures and triumphs, I wanted to encapsulate into this one book. And it's obviously mostly pediatric airway, but because I cover adults as well, it has other cases that are not just peds.
Yeah, well, very, very well summarized. Book is amazing. I didn't know there were 16 stories. They each felt So awesome. And I give it my seal of approval. I am a colleague of yours. The stories are legit. The pathology is legit. I was reading through them like, oh, where's an exit procedure? Oh, she talks about it. I don't want to keep spoiling everything. I have now started recommending it to med students because I love how deep you go. And you say, if you're putting a child to sleep for a certain case, this is how you want to keep them spontaneously breathing. Book is amazing. And we will find ways to put you in front of our residence fellows, but also mid-career, which gets me to you. You are so busy. Where in the world did you find time to write? Why do you write? I could think of 30 things you could be doing, including picking the kids up from basketball. It's in the book, so I can admit that. But where do you find the time and why?
So, one thing that I thought a lot about is like, what can you contribute to the world as an individual? All of us are super dedicated clinicians. We're smart, we're self-selected, but I think that not all of us are great in a leadership capacity in the sense of leadership on committees and in conferences. Some people, that is a very good trait of theirs. They have a lot of executive function skills, or they're really academic in terms of like research production. And I did not feel that that was where like my value to the world lay, aside from my patient population. But I've always been a writer, and I really do see the world in stories. I mean, people make fun of me, all my friends and my family. Why can't I just come home and just say something happened? Why does it have to be this huge life lesson and narrative? But I really think that there's great value in that in terms of teaching and relating, and also for yourself, just combating the things that bring you down in life. And so that's really, it fueled my fire rather than taking away from my time. And as we all know, when something is a passion of yours, you create space for it, as opposed to it being something you're, oh my gosh, I finished my day and now I have to do this assignment. So I did it late nights and all the cracks. I dictated on my hour-long commutes. I would write in the bathroom. I mean, I just did it during turnover, when I was frustrated that a patient wasn't waking up. I just did it everywhere.
Thank you for that. That's the why. But this wasn't your first book.
That's true. So my first book was, I think of as the book I was forced to write instead of the book that I really wanted to write. So, I always wanted to write a book. This was a lifelong dream since I was 7, and I needed the substance for it, but I wasn't a fiction writer. So I needed the life experience to also feel like not just I'm writing for myself, but something that has a greater value. And when I had my third child, had just come out of the NICU, I was diagnosed, or I actually found myself, very advanced breast cancer. It ended up being stage IIIC. So that's not where you want to be, especially as a head and neck surgeon in any cancer, even breast cancer. And therefore, I ended up, just due to circumstance and really feeling that I couldn't push all the way through chemo, being fully like employed. That was the one time in my entire life where I did not continue my career despite everything else going on in my life. And therefore, I had some time. It wasn't a pleasant time and I didn't feel very good, but I had some actual like designated writing time whenever I was not too sick. And I had this life experience that was unfolding in front of me, like really becoming the patient when you were the doctor. All that entails, all the coming back to life afterwards and redefining yourself, and just this huge personal arc. And I decided that I wanted to create the Girlfriend's Guide to Divorce of Breast Cancer, is what I kept calling it, but from the surgeon turned patient turned surgeon again perspective. And that was my first book, Hell and Back.
How long did that take to write? What was the gap between that and Breathless?
So it was very, very different because that book, the 6 months that I was going through chemo, I wrote half of the book. And then I had to get back to work in the middle of radiation. And if anyone's gone through it, you're crazy exhausted. So I lost all my bandwidth. I mean, just to function during the day, recovering from chemo and going through radiation, and like having 3 little toddlers and a baby, or 2 toddlers and a baby. So it sat in my computer for another half a year, but that was really just situational. And then I said, this is one of my dreams, and I do believe it has value for patients and for other doctors going through any type of health crisis. And so I picked it up again, but there was that delay. So the whole process then took about 2 years. And, the editing process that comes after writing a book, if you are really, really want perfection, that takes another really whole 6 months to a year. Because at the end of all my storytelling, I decided if I'm putting something out into the world, it has to be comprehensive. So I have to include, all the like reconstruction and many steps so that a person could just pick it up and it's going to cover almost everything is with regard to, let's say, breast cancer, even though I'm not an oncologist or a breast surgeon. If I'm going to be a doctor writing a book about a medical problem, it has to really have an entire collection of experiences, except for, thank God, distant metastasis, which I did not cover because I did not experience. But it was like 2.5 years.
I felt that in the book Breathless. Authenticity is a trite, overused word, but you literally felt like I was right by you in the OR, turning the head, masking the patient, reaching for the graspers, the thought process through the cases. So then what was the gap between Hell and Back and Breathless? How much time did you take between those books?
So first of all, I don't want to be morbid, but I thought it would be very depressing to start a medical memoir and then not live for it to come out. So I kind of in my mind thought, 10 years from the time of diagnosis is a pretty good accomplishment when you have advanced disease. So it was only after I had that under my belt and I didn't feel like I was going to become like a lifetime drama story that I felt like, okay, I can write about my career now. So that's why, and also I needed a career to talk about, right? Because Hell and Back was the beginning of my career. So 10 years later, I felt that I'm in the position to have amassed all these pearls of wisdom and all that I gained from so many different mentors and all these clinical experiences that I had, like what it took to write Breathless. So that's where the gap came from. And then the two other blocks that I had to overcome before starting Breathless, we could talk about more in detail if you want, is what do I do about the HIPAA compliance problem, which I just butted up against. So I actually did think about that for a year and worked that out, both in my own head and while talking to many colleagues, in order to really say, hey, I can do this in a way that is going to protect me, the patients, not have my institution attack me, etc.
You said there were two blocks. One was HIPAA and
Someone to believe in me was the other one, because this was, first of all, it was all my personal expense. And it was a giant expense. So I had to believe that, like I said, I obviously my own ego is very involved in this, but it also had to have a purpose in the world that was worth putting in all my own money that everyone tells you you'll never see back because that's just the way of the world for books, books in and of themselves, not necessarily what they lead you to. And somebody became that person, this woman that I met who online, who first said she would not have any bandwidth to work with me. And then 6 months after reading my very, very rough draft for Breathless, she called me back. And I got this one email saying, oh my God, I just read your first book. It was sitting on my computer all this time. I had sent her a PDF. And now that I read it on my vacation, just impulsively, this book editor / publisher, I want to work with you on the next thing. And once someone believed in me, I figured out the HIPAA thing. I always had the substance, around in my head. That's when I really said, I'm going to start putting this pen to paper, which is obviously computer, in reality.
so if I can do my math right, if I can add a decade onto two toddlers, a baby, a husband, and two dogs, you started writing kind of in their preteen years. So you started when life was very complicated. How long did it take you to write Breathless? How did you do it in a full clinical load, full family load?
So it's really funny. I know exactly when I started it because once a year, my family goes away for Passover and we go to a destination, my extended family, but then I'm left alone in the hotel room for a couple days while my kids are out with their cousins. And there's no guilt because they're just like in a wonderful, beautiful place. And I sat there in my hotel room and I said, I'm going to start. And there were 5 cases that, I mean, those were the ones you just carried in your soul. So that beginning, it just spilled out. I mean, I had to perfect it and refine it and all that stuff, but just putting it down, I knew exactly who those 5 patients were. And some of them were obviously like the ones that tortured me for years because something did go wrong and it had not ended in just one little, okay, here was my problem. There was an airway foreign body. I removed it. I saved this kid's life and I moved on. And so that's where I started. My other little secret, my other dirty little secret is that I don't ski. I'm very embarrassed about that, but I didn't want my kids to be that way. So ski trips, I am also left alone in the ski lodge where I provide emotional support and money, but I don't have to physically be out there. And you've got all this time. You can get a margarita or a Bloody Mary if you want early in the morning, no judgment. And I brought my computer and I had this time, this just amazing time. And those were my 2 giant chunks in that first year where I really did a bulk of the work. And the rest was all little bits and pieces.
Well, fill in the rest. How long? It's always great chatting with the native New Yorker because I can't get a word in edgewise. Tell me, how long did it take? So you started writing, how long till you got something to an editor, and then we're going to talk about your forward. But how long till you got a draft?
So it took a year and a half, I would say, until I hit the point where I let somebody read my rough draft. And I've talked about this a bunch of times because I find it to be an amazing how people's inputs, big and small, can really mold what you produce in this world. And so I did not have that section about the personal part. It was built into the story, obviously, but not as a designated per case section. So I had 2 people read it initially, not the publisher. I had a neighbor of mine who's also a good friend, and I had my teenage 13-year-old daughter, or 12 and a half. And both of them independently came back to me and said, I want to know what happened after that story ends. And I said, what do you mean exactly? Like nothing crazy happened. And they're like, I want to know what happened when you got home, when you got into your garage. And that is how I started writing the at-home section for each chapter. So that actually, I went back to every experience and then finished it off. And obviously, remember, there's a lot of literary license, so those experiences might not have perfectly matched the amalgam of cases that I was talking about, but it was all of those experiences were real. And that was hard,
All
because
right,
I had to
hold
talk.
on. There's like no way I'm going to be able to drive this here, so I'm going to keep cutting you off. All right. So it took
Okay.
you 1.5 years to get a draft, and then from the draft till you actually saw it to buy, how long did it take?
Including editing time, which is such a big component afterwards, it was probably 2 to 2.5 years.
So from that first Passover, when you were sequestered in a hotel, till I could buy it, maybe 4 years?
No, 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 like total, sorry, because it was like a year and a half to write, and then that 6 months to, write that extra section and start the editing process. So I kind of did it simultaneously. I might finish one section and
So
then
how
start
much
editing
time
other
from the
things.
first
Two and a half
Passover till I
years
could buy it?
total.
That's pretty good.
Two and a half
That's not
years.
bad. Not bad. What are benchmarks? Do you know, or is every author different?
I guess it depends on whether, I mean, the old years of, having certain number of pages that somebody reads, I think that that's gone to a certain degree. So I think that's how authors used to work. I really was like, I need it. And I didn't give it to my editor to read and edit in a professional way until felt done. And I had read it myself twice and I chat GPT edited it myself once. So because you're pay, I mean, again, it's all my own dime and you're paying them for their time. So I really wanted it to be like as perfect so that what they gave to me was like super valuable, not just like typos and grammatical errors.
Yeah, that makes a lot of sense. You have a very special forward. Can you please acknowledge that and talk a little bit about that?
So Mike Rutter, I mean, it's funny, you asked me like, oh, did you do your residency in Cincinnati? I mean, sorry, fellowship, because it sounds like he mentored me. And he was one of those, I adopted myself as a mentee. And it started really small. This is another kind of amazing story where I had a patient problem. I called Love Javia at CHOP, who was my senior fellow, who was then an attending at CHOP. And about this particular problem, he's like, Mike Rutter's the only one that's done X. And that's how I first met him, was just a phone call about a patient reaching out to somebody I literally didn't know and only heard of. But he became a person that was willing to read my chapters one by one as a favor and give me some input. So he was in the background, aside from all the other people that I mentioned. He was a huge factor in moving forward, supporting me, saying yes. He's very pithy. So it would be like, nicely done. I mean, it wasn't, it was just a little bit of encouragement, knowing that I was on the right track of a value. And so at the end, I obviously asked him to write the foreword, but the foreword is a true story that I think does embody my tenacity, which is, I think, why he was willing to go to the mat for me. And obviously I super appreciate it. And then also very deliberately rode his coattails, because he has validity and I really don't on the national forum. And, you got to use what you have.
I know you have young children, so I'm going to give you a challenge and I'm going to ask if you've listened to my podcast, I asked this question. And if you haven't, well, you can listen to more of them. So our daughter taught us a high-low buffalo. If you've listened, you know what I mean by that. So what is the high, what is the low, and what is the buffalo? The buffalo's the zebra, the unusual thing that happened. And the right way to answer it when your children ask you on vacation, Dad, what's the high-low buffalo? Well, the high was spending time with you, children. The low was, geez, kids, I wish I could have spent more time with you. And the buffalo was like, it's too bad I have to work. Otherwise, I could spend more time with you, right? The right answer is all about them. Walk me through, and we'll go one by one. Give me the high of this experience, the low, and then the most bizarro thing during this process.
The high is 100% whenever anyone from the category of people I wanted to reach says, this resonated with me. So I got a message. This is seriously one of my highs. I got 2 messages on WhatsApp very recently from pediatric otolaryngologists on one of the P's worldwide group chats, saying, one person said, I have never, listened to something that so embodied my personal experience. And thank you for writing this, because it felt like you were talking about myself. So just giving people like us, very dedicated, a feeling like we are suddenly heard and understood, and someone's articulated it. That's a super high. And the other high is just on the flip end of that is this one I'm waiting for. It really hasn't happened, is what you just said, the medical student or the pre-med student, because that was my other target, who says, I read this and now I want to dedicate my life to something that has this level of like sacrifice, ups, good, bad, ugly, all of that. And if I can like reach those 2 sides and it's something that they are happy to have read, that's my highest high.
Yeah, I was reading the book on a plane to the CEORL meeting, and sitting next to me was a pediatric otolaryngologist from Dublin. So I just sent her the book. So we'll see if it resonates across the ocean. I mentor a lot of medical students, and they've read it, Tali. They love it. And I told them to go back and read it before they start their internship, because there's a lot of science pearls in there. So that's the high. What's the low of the whole process? And focus on Breathless. What's the low?
I don't want to be, negative about it, but it's the financial output, because I really went all the way in terms of wanting it to be a very professional product, but there's not money in it. And therefore I reached this point where I realized, just from my personal finances, because my husband was always encouraging me, yeah, do that, get a PR person, have it edited, put it out there, follow every road. And by the end of the year, I was in a hole where I had to, take from my line of credit hole. And then just this scary feeling that I just did something really selfish that maybe I shouldn't have done vis-a-vis my family.
Thank you for that. Um, but it's much more than that. It's more than writing a book. I mean, it's a passion, it's a hobby, and we all spend our resources and money not just in the bank, but on things that give us life. All right, buffalo. Give me a buffalo. What's the most bizarre thing? I'm gonna consider Dr. Rutter. I didn't call him a buffalo, and I'm sure he's gonna listen to this. He's an icon. We'll call him a goat. How about we call Mike Rutter a goat? Okay, he's one of the greatest of all time,
Yeah.
pediatric airway surgeons, mentors, and friends. But what's a buffalo for you during this whole process?
Can it be that a homeless person stole it from the lobby waiting room of my office last week? And he's either using it as toilet paper or a heating element to keep like the fire going at night. And I'm wondering why, it's just very funny. It goes like in my one of my offices with like a more challenging population, not the pediatric ones. People keep stealing it.
What have patients said about the book? Any of those 16 patients that you feature, obviously their parents or maybe them, or um, other patients. What has the reaction been? And it's going to be mixed. So I'd say, oh gosh, are you going to write about me?
So every single chapter is not a true story in the sense of it's an amalgam. It's a true amalgam, and all the details are changed, except one. That one, I'm very close with the mother. I reached out in advance. I told her the entire story. I told her I wanted to write a book. This was at the way outset because she was my first patient I wanted to talk about. I gave her the entire chapter. I obviously did change the names and some details, regardless of what she was going to say. And I got her direct feedback. So she's the only mom who is like, this is my child. And she wrote back to me maybe within an hour, not even longer than that. I don't want you to change anything. You perfectly captured our experience. You are free to use her actual name. I did not do that. I didn't think that was a good idea. Plus, she's a child and she might change her mind later on. And that, so I know directly from at least the mom who went through that. And this was like the one that didn't turn out well, right? So this is not the triumph. That she felt like this elevated her and her husband and her child. And obviously it was very carefully chosen to be that, one where I was being honest, and I am still scared because we all know the climate we're in. I mean, you are open to scrutiny, you're open to lawsuits, no matter, just the world isn't fair, and New York is very litigious. No matter what you think you do to protect yourself, it doesn't stop someone from bringing litigation against you, whether it's valid or not, or just social media blasting you. And you're very, I'm out there and I'm very susceptible if somebody was unhappy with me. So, but with my patients' families that have read it, they're very, very positive and effusive. And I think I'm not afraid for patients to know me on a personal level, but that's just my choice that I've always made. So I think some people really want to keep that separation. And I do, in the OR, I don't say call me Tali to my parents because I think they need that comfort of like, you are my child's surgeon.
So how do your current patients react? So they're not sitting with a one-time author, they're sitting with a two-time author, which means the probability of being a three-time author is big. Are you going to take my stories? What do they ask you?
My biggest fan is one particular patient's dad. He's so funny. So his kid would have been a chapter, 100%, except I had just submitted the book for upload. And then he played out in a very, like, it's going to be my next one. So he was so excited that I was an author that this kid was in the ICU, intubated, sedated, things weren't going so well. He wasn't blaming me. Every person that walked in the door, he had bought my book on Amazon. Every nurse, he's like, do you know who you're talking to right
So
now? This is
so
an
forget
author.
the good parents. I want you to hear me. Some people aren't happy. How like have parents gotten upset or no?
Oh,
If
yeah.
they haven't, that's terrific. But just, I want you to be fully transparent for our audience. This isn't all fun and happiness. I mean, tell us some of those challenging patients that you see regarding the book now.
So far, I mean, being honest, I haven't gotten the negative backlash. I'm not saying that won't happen. I'm sure it will. And I'm on social media, so people write nasty things. That's just but it hasn't happened. And when it does, it's going to be really hard. I'm going to be hurt and I'm going to probably need a therapist.
Yeah, Dr. Lando, you have like 9,000 people loving the book. If one person gets upset, you'll be okay. That's really great to know. A couple more questions. What's next? What's your third book going to be? I can't wait to read it. And I'm going to order Helen back. I promise you. I'm going to order it. I want to see the trilogy. Give me a trilogy. Do I get some royalties if I just gave you the idea of a trilogy?
It's very funny. I mean, so far for my I have been doing a PowerPoint presentation on the twist details of pediatric ENT, which are the cases as they roll in that I'm doing it more in a didactic way, but obviously each of those cases still has the pearls of wisdom. And so I am amassing enough for a third book. Don't make fun of me, but I really want it to be a TV series. And that would be like one of my just like life fun, cool, like if this spun off into, the pit-like version of ENT, I think I'd be pretty happy.
So there's no third book, or you're thinking about it. You don't know a topic yet. The first one was the personal journey. The second, maybe the professional and personal. You don't have a third one yet in mind?
I don't have a third one yet in like a different vein. It's more like, should I do like the next in a series of Breathless, like Still Breathless or More Breathless?
How far are we till Passover?
It just passed, and during this Passover, I've spun into this direction, like these conversations with you. Leanne Dessert, she's all over in the book, like, so I talk about her a lot, and she's as I call her, my buoy in the storm, and definitely my work wife. She said to me the other day, everything that I don't want to do just fuels your fire. So I love podcasts. I love speaking.
But you've also been connecting with medical
medical
students. Talk about that.
Yeah, I'm on my yeah, I really, really wanted to go like on the road in a way with these medical student, really honest discussions that they seem to thank me like crazy. They say, we get exposed to a lot of specialties in a formal way, but nobody tells us the life, like the deeper parts of the life. When I've been talking, I just spoke at Columbia, I've already spoken at Cornell, and I spoke at New York Medical College. And what I end up talking to them about late night with pizza in some tiny room is, when did I decide to get married? How did I have a honeymoon? The answer is no. How did I figure out whether I could handle a surgical residency and a kid? Who watched my kid when the nanny didn't show up? Like,
I get it. So can people reach out to you to have you speak to their med students, to have you speak to their residents? Are you amenable to that?
I really am. I think what's actually been the best is a med student. They can organize these med students events so easily because they don't have to go through the whole system. So they just find a room. They have funding for usually, like I said, like pizza and soda, and then you just as a surgeon, you have to take your ego down actually like 20 notches because only like 3 to 5 people are going to show up. And I've learned now to not take that personally. So those are not big attendance events because everyone's pulled in a lot of directions, but it's just a very fulfilling, wonderful experience. And on my own time, usually late at night, that's how I could do it.
Yeah. And one person's there for the pizza, the other for the soda. So I know how hard that is, but the book is amazing. I want to give you the final word. It's your time that you've given us today on a busy academic day. The book is amazing. Amazing. I have a poker face. This is my happy face. It's terrific, terrific, terrific. I couldn't put it down, and I've recommended it to nearly everybody. Final thoughts, final words. I'm so excited by you finding a passion that is different than the beaten track. But I will give you the final word. Dr. Lando, anything we haven't talked about that you want to address or bring up?
I think that in this world, there's a lot of drive towards division. Like you got to have your professional life and then you got to chunk out the other stuff. And I guess I'm trying to figure out the way to integrate. And I work my ass off. I'm the worker bee and I'm fine with that. I'm like the workhorse worker bee. I was never going to be the chairman. I'm not saying I might not have elements that are inspiring, but that's just not the person that I've become. And I don't want to take away. I want to add. So you do have to pursue your passions, but you got to find the cracks because you can't necessarily make the time, separate. And so that's what I'm saying. Like you can still do it, follow your passion, but you got to find the ways to work it in.
Amazing. How do people find Breathless?
Okay, so it's super easy. It's available on Amazon. Also, I have a website and you can reach me through the website. It's very easy, www.drtalilando.com, and my Gmail address is on there. And I guess if I get too famous, I might be overwhelmed and have somebody actually vet my emails. But as of now, I do not have that. So it's you can find me on Instagram at Dr. Tali Lando. You can find me on my website, and all these ways you can find Breathless as well. And there's an audio book for people that really don't have time to read, which was another giant 8-month passion project. Also on that financial, list, all from the same year that I submitted as my small business and got a little deduction. And that also is really fun because I did it all myself, and I got Dr. Rudder into a studio in Cincinnati with his New Zealand accent to read the foreword, which I was quite proud of.
Well, thank you so much. This was awesome. Highly, highly recommend the book. And I'm super glad I made a new friend. A terrific, terrific book.
Me too.
Dr. Tali Lando, thank you so much.
We hope today's episode sparked some fresh ideas. If it resonated with you, please subscribe and share it with friends. Have thoughts or suggestions? Use the feedback form in the show notes. We'd love to hear from you. And don't forget to follow us on social media for highlights, behind-the-scenes content, and updates. Thanks for listening. See you next time.